Hello, my name is Vicky. I'm going to be your nurse for the day. Could you state your name and your date of birth for me?
Megan McDonald, 4/23/93.
Okay, what we're going to do is a physical assessment on your respiratory system, your heart and your neck vessels, and also your abdomen and kidneys.
Okay.
So we're going to start with your posterior chest wall, so turn around for me. Alright, I'm just going to palpate on your spinous process and you tell me if you feel any tenderness or pain.
Nope.
Alright. Next, we're going to do your symmetrical expansion, so take a deep breath for me. Okay, now we're going to do your tactile firmitis, so just repeat the word 99 as I go across your back.
99, 99, 99, 99, 99, 99, 99, 99.
Okay, great. Next, we're going to percuss. We're just checking for dullness. Okay, and now I'm going to listen to your lung lobes and just breathe normally for me. Okay, great. Now you can turn around and we're going to do the same thing to the front. We're going to start off with your symmetrical expansion, so take another deep breath for me. Okay, now we're going to do your tactile firmitis again, so repeat the word 99.
99, 99, 99, 99, 99, 99.
Okay, now we're going to percuss again on the front, checking for dullness. Okay, and I'm also going to listen to your lung lobes in the front, okay? So take a deep breath. Alright, great. Next we're going to move on to your heart and your neck vessels. We're going to start off with your carotid artery. So I'm just going to palpate. Next I'm going to listen with my bell. Do you feel any pain at all?
No.
Alright, good. Now we're going to move on to your aortic, pulmonic, tricuspid, and mitral valve in your heart. I'm just going to listen first.
Okay.
Your aortic, pulmonic, mitral, and tricuspid. Okay, now I'm going to ask you to lay down for me because I'm going to palpate those. Okay. Start with your aortic. And let me know if you feel any tenderness or pain. Pulmonic, mitral, and tricuspid. You feel any tenderness or pain? No. Alright, now I'm going to listen again as you're laying down. Okay, everything sounds good. So you can just keep laying down for me. We're going to move on to your abdomen. First, I'm going to check your contour. Alright, now we're going to move on to your bowel sounds. I'm going to listen again in all four quadrants. Okay, everything sounds good. Now I'm going to listen to your vascular sounds, your aorta, your renal, iliac, and femoral arteries. Your aorta, your renal, your iliacs, and your femorals. Okay, everything sounds good. And now I'm going to start palpating your organs in your abdomen. I'm going to start off with your liver, and I'm going to go light and then deep, okay? Light and then deep. And then I'm going to move on to your spleen. Light and deep. Okay, and then next we're going to do your kidneys. So if you could sit up for me. I'm just going to do a little percussion here. Okay, and you can lay back down. We're going to palpate your kidneys as well. Do you feel any pain? No. All right. Next, we're going to do Murphy's sign, and this is where I'm just going to palpate your liver, and you take a deep breath for me. Do you feel any pain? Okay. Next, we're going to do rebound tenderness. What I'm going to do is I'm going to take my hand, I'm going to push slowly and deeply, and then I'm going to release quickly. And whenever I release, tell me if you feel any pain. No? Okay. And the next sign we're going to do is Rothschild sign. I'm going to palpate in your lower left quadrant, and this is going to tell me if you have any pain in your right lower quadrant where your appendix is. No. And lastly, we're going to do your ileosis sign, and I'm going to raise your right leg. I'm going to push down on the bottom of your thigh. Do you feel anything? No. Okay, and this is also testing for appendicitis. Everything seems good? All right, and that completes our physical assessment. So thank you. All right, so for this patient, the posterior chest was symmetrical with the spinous processes vertical and straight. The thoracic cage was also symmetrical. The patient breathed with relaxed posture and no use of accessory muscles. The AP to T ratio was consistent, and on palpation of the anterior and posterior chest, the symmetrical expansion and tactile phrematus were both intact. There were no masses or lumps noted. Resonance was present on percussion in all lung fields. The lungs were equal and clear bilaterally on auscultation. There were no crackles or wheezes heard. For the heart and the neck vessels, the carotid arteries were palpable, equal, and bounding. There were no bruits heard on auscultation. All the vessels of the heart were palpable and auscultated with no abnormalities noted sitting or lying down. The jugular distension was present, and the jugular venous pulse was visible on inspection. There was no jugular distension present, and the jugular venous pulse was visible. The abdomen contour was flat. It was symmetrical with no visible masses or bulges. The skin was smooth with no striae lesions. The umbilicus was midline and inverted. All bowel sounds were active in all four quadrants. There were no abnormal vascular sounds heard over the aorta, renal, iliac, or femoral arteries. There was no tenderness reported to CVA percussion. Tympany was noted to general percussion. There was no pain noted on palpation of the organs. Murphy's sign, rebound tenderness, Rothschild sign, and ileosis sign were all negative with no pain reported from the patient. Thank you.